Hi, I'm Tanner. I'm a respiratory therapist. What's your name?
My name's EO.
EO. All right. Well, today I'm going to be talking about National Asthma Education and Prevention Program with you. I'll start off talking about just the program and the purpose and goals. The National Asthma Education and Prevention Program was initiated in March 1989 to address the growing problem of asthma in the United States. The goals of the NAEPP are to raise awareness of patients, health professionals, and the public that asthma is a serious chronic disease, ensure the recognition of the symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals, ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment education programs. The ultimate goal of the NAEPP is to enhance the quality of life for patients with asthma and decrease asthma-related morbidity and mortality. So some objectives for patients and the public will be to increase public awareness of asthma as significant public health problem, increase public awareness of the signs and symptoms of asthma, improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma, particularly in high-risk populations. Also define guidelines for effective asthma education programs, promote development and use of patient and family education materials. So for health professionals, increase knowledge, attitudes, and skills of all health professionals regarding signs and symptoms and management strategies for asthma. Encourage health professionals treating patients with asthma to adequately track and monitor patient status to use objective measures of lung function. Assist and encourage health professionals, schools, and continuing education programs to include up-to-date and accurate information on diagnosis, pathogenesis, and treatment of patients with asthma. Also promote and encourage the concept of active patient participation with physician in the management of asthma. Develop resources and materials for use by health professionals. Promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices. So some clinical issues. First, to establish asthma diagnosis, you would use the medical history and physical examination to determine the symptoms of the recurrent episodes of airflow obstruction are present. Also, you would use spirometry in all patients greater than 5 years of age to determine that airway obstruction is at least partially reversible, and then consider alternative causes of airway obstruction. To manage asthma long term, there are two ways to do this. You can reduce the impairment and reduce the risk. So to reduce the impairment, prevent chronic and troublesome symptoms, require infrequent use of less than 2 days a week of inhaled short-acting bronchodilator for a quick relief of symptoms, not including prevention of exercise-induced bronchospasm. Maintain normal pulmonary function, maintain normal activities, meet patients' and families' expectations of satisfaction with asthma care. And the goals for reducing the risk will be prevent recurrent exacerbations of asthma and minimize the need for emergency department visits or hospitalizations, and prevent loss of lung function for children, prevent reduced lung growth, and provide optimal pharmacotherapy with minimal and no adverse effects of therapy.